Millions of Americans suffer from Parkinson's disease. We're focusing on a treatment today, and with more on how this works is local North Shore neurologist and pain management specialist, Dr. Chad Domang from the Cypress Point Hospital. Thanks for joining us.
Good afternoon. Happy late Cinco de Mayo.
Okay, so talk about Parkinson's disease, the cause and the symptoms.
My background is neurology, and Parkinson's disease is one of those diseases that when you see it, you never forget it. It is a neurodegenerative disease. So what happens, we have these brain cells called substantia nigra, and they produce a substance called dopamine. It allows us to do fine movements that we take for granted. People with Parkinson's disease, these cells start to die. So think about like Lou Gehrig's, we know from the Saints player Gleason how that affects. It's very similar. As these die, these patients freeze, they can't move, their handwriting gets small. They develop this tremor. It looks like they're rolling something in their hand. And as it progresses, they can get dementia. And at some point, it eventually takes their life.
Okay, and I know Muhammad Ali was another famous individual that brought light to that. So tell us how this new device will work better than others.
So when you look at Parkinson's disease, there's a host of medications. And the goal of these medications is to increase dopamine and to try to keep dopamine from being broken down. The problem with these medications is you get a host of side effects, stomach effects, affects your sleeping, it makes you groggy. And so what deep brain stimulation is, it's an electrical device. This is the actual wire that I'm holding up to the camera. And what we do with this wire, this is a slice of a brain. The wire is actually inserted into the middle portion of the brain into what's called the basal ganglia. So it's called subthalamic nucleus and globus pallida interna. And what the device does is sends an electrical current to the cells that are still alive, and it does what the medicines do. It increases dopamine, but you don't get all the side effects of the medications. So what I tell patients when they're looking at these devices is it gives you the good of the medications without the bad. But here's the bad news, Liz. Whether you're taking the medications, whether you're doing one of these devices, it doesn't prevent the progression of the disease. And unfortunately, medication devices, disease will still take a natural progression.
So lastly, the headline, if someone is interested in doing something like this, would you recommend it, and where can they learn about this locally?
So I would recommend it for any patient that's getting good relief from their medications but having side effects. This is the actual device that's implanted. It's put on the clavicle, much like a pacemaker. There's a whole process. You have to have a halo placed. There's mapping. So there's a lot involved with it. There is a local neurologist, Dr. Julia Staisch, S-T-A-I-S-C-H. She's with Ochsner. She is a movement disorder neurologist. She uses the latest technology, which is Boston Scientific. They have a device that moves the current around a little bit better. But it is something that you need to understand. You need to sit with a high-level neurologist such as Julia and make sure that this is the right device for your disease process.
Thank you so much, Dr. Chad, always bringing us great information on medical conditions and the treatments for it. Appreciate it.
Absolutely. Lastly, happy May the 4th be with you. My Star Wars tie. I know I'm a little late, but all the geeks out there.
Thank you.
Absolutely.